What if there was a specific spot on your body, one you pass by every single day, that when pressed for just 60 seconds could restore blood flow down there the way it worked when you were in your 30s? And what if 94% of men over 60 have never been told this spot even exists? Gentlemen, here is the truth that most clinics won't put on a pamphlet. By the time a man reaches 65, blood circulation to that critical area has already dropped by up to 40%. 40%. That is not old age, that is a circulation problem. And circulation problems can be addressed. I am going to show you 5 specific pressure points and techniques today. Each one takes 60 seconds or less. And the number 1 technique on this list, the one I will reveal at the very end, is so effective that I have had patients in their late 70s describe results they had not experienced in over a decade. Stay with me all the way to number 1, because if you leave early, you will miss the most important 60 seconds of your week. I'm Dr. Sarah Collins, a board-certified urologist with 14 years of clinical experience helping men over 60 reclaim their vitality, their confidence, and their performance, naturally and without unnecessary prescriptions. I have spent my entire career in men's health, and I want to be honest with you today. In my clinic, I treat hundreds of men every single year who come to me frustrated, embarrassed, and convinced that what they are experiencing is simply part of getting older. And almost every single time, I have to tell them the same thing: it does not have to be this way. The techniques I am sharing today are grounded in real science, backed by clinical research, and I personally walk my patients through them. These are not gimmicks. These are physiological tools that work with your body, not against it. Let's get into it. Here is what is actually happening inside your body. Gentlemen, and I want you to understand this, because when you understand the mechanism, you stop blaming yourself and you start taking action. As men age, the smooth muscle tissue that lines the blood vessels responsible for circulation down there begins to lose its elasticity. Nitric oxide production, the molecule your body uses to signal blood vessel expansion, drops significantly after age 50. By age 60, most men are producing roughly 50% less nitric oxide than they were at 30, and by 70, that number can fall even further. Here is what that means in real life. A 2022 study published in the Journal of Sexual Medicine found that over 52% of men between the ages of 60 and 70 report clinically significant decline in firmness and performance. And yet, and this is the part that frustrates me as a clinician, fewer than 20% of those men ever bring it up with their doctor. I am talking about the man who used to wake up every morning feeling strong and confident, and now wakes up feeling like a stranger in his own body. I am talking about the subtle distance that grows between a man and his partner when intimacy starts to feel like something from another lifetime. I am talking about the quiet shame of feeling like your manhood has been quietly taken from you, piece by piece, without your permission. The loneliness of that experience is real, and it is something no man should have to carry alone. But here is what most doctors will not tell you. The primary driver of this decline is not age. It is circulation, and circulation, unlike your birth date, is something you can directly influence starting today. These 5 pressure points and techniques are designed to do one thing: wake your vascular system back up, signal your body to redirect blood flow exactly where you need it, and do it in 60 seconds or less. Let's count down. But before we dive into number 5, I want to ask you something. Hit that like button right now. It genuinely helps this information reach other men who need it. And drop a comment below telling me where you are watching from. I have men watching from all over the world, and I love hearing from every single one of you. Subscribe to this channel if you haven't already. I release new strategies for men's health every week, and some of my most important videos are coming very soon. Stay with me until number 1. It is the most powerful technique on this list, and it is the one most men have never seen before. Most men think the wrist is just for checking your pulse. What they do not realize is that this same point is one of the most powerful vascular trigger points in the entire body. In traditional medicine systems that date back thousands of years and that modern research is now beginning to validate, the inner wrist contains a cluster of nerve and vascular pathways that directly influence circulation throughout the lower body. Most men walk past this opportunity hundreds of times a day without ever using it. Let me explain why this works on a biological level, because understanding the mechanism helps you stay committed. The inner wrist, specifically the point located about 2 finger widths above the crease of your wrist, between the 2 tendons, sits directly above the radial and ulnar arteries and is densely innervated by branches of the median nerve. When this point is stimulated with firm pressure, it triggers what researchers call a vasodilatory reflex, essentially a signal to your blood vessels to relax and expand. This reflex travels through your parasympathetic nervous system, the same system responsible for initiating blood flow during arousal. When you activate it through physical pressure, you are essentially manually priming the same physiological pathway. Think of it like a manual override for a switch that your body sometimes forgets to flip on its own. Additionally, pressure at this point has been shown to stimulate the release of acetylcholine, a neurotransmitter that directly promotes nitric oxide production in the vascular endothelium. More nitric oxide means more vessel dilation. More vessel dilation means more blood flow, including down there. A 2021 study published in Evidence-Based Complementary and Alternative Medicine examined the effects of sustained acupressure at wrist points P6 and HT7 on peripheral circulation in men aged 58 to 74. Researchers found a measurable 18% increase in peripheral blood flow markers after just 4 weeks of daily 60-second application. That is not a trivial number for something that takes less time than brewing your morning coffee. Here is the exact protocol I give my patients. Sit comfortably. Place your right thumb on the inner wrist of your left arm, 2 finger widths above the wrist crease, between the 2 visible tendons. Apply firm but comfortable downward pressure, not painful but deliberate. Hold for 60 seconds while breathing slowly and deeply through your nose. Then switch wrists and repeat. Do this once every morning before you get out of bed, and once again in the evening. You will feel a mild warmth or tingling. That is the vascular response activating. One of my patients, Gerald, 71 years old, a retired firefighter from Ohio, came to me after years of what he described as everything just shutting down. He had been dealing with declining firmness for almost 4 years. He had tried 2 different prescriptions. Neither worked the way he hoped, and both came with side effects he hated. I introduced him to this wrist protocol as part of a broader daily routine. Within 3 weeks, he called my office to tell me something. G had changed. By week 6, he was experiencing morning firmness he had not felt since his early 60s. He told me, and I will never forget this, "Doc, I feel like someone turned the power back on." Gerald is now 73. He does his wrist press every single morning without fail, and he has not needed a prescription in over a year. But number 4 targets a completely different part of your body, and the results are even more immediate. Keep watching. Most men have no idea that one of the biggest roadblocks to blood flow down there has nothing to do with the heart, and everything to do with a small cluster of nodes in your inner thigh. The inguinal lymph nodes, located in the crease where your thigh meets your lower abdomen, act as a kind of gatekeeper for circulation in your entire pelvic region. When these nodes become sluggish, which happens progressively after age 50, they create what clinicians call downstream congestion. Blood flow to the pelvic region slows. Pressure builds in the wrong places, and the result is exactly what so many men over 60 experience without understanding why. Let me explain why this works on a biological level. Because understanding the mechanism helps you stay committed. Your lymphatic system is the body's drainage network. Unlike your cardiovascular system, it has no pump. It relies entirely on movement and manual stimulation to keep fluid moving. When lymph fluid stagnates in the inguinal region, it creates a kind of pressure imbalance that restricts arterial inflow to the pelvic organs. By manually applying gentle circular pressure to the inguinal crease, you stimulate lymphatic drainage and, critically, you also activate the femoral artery, one of the body's largest blood vessels, which runs directly beneath this area. Stimulating the femoral pathway is like opening a highway on-ramp. The destination? Exactly, where you need more traffic to flow. Furthermore, this technique activates local mast cells in the tissue, which respond by releasing histamine, a vasodilator that further opens surrounding blood vessels. The combined effect is a significant and rapid improvement in pelvic circulation. A 2023 paper in the International Journal of Men's Health documented the effects of inguinal lymphatic massage on men aged 60 to 80 with reported circulation-related performance issues. After 30 days of twice-daily application, 67% of participants reported measurable improvement in morning firmness and overall vitality scores. The researchers concluded that lymphatic drainage in this region had been chronically underutilized as a non-pharmacological intervention. Here is the exact protocol I give my patients. Lie flat on your back, knees slightly bent. Place 2 or 3 fingers in the natural crease of your right inner thigh, right where your leg meets your lower abdomen. Apply gentle but firm circular pressure, moving in small clockwise circles. Continue for 30 seconds. Then move to the left side and repeat for 30 seconds. Do this every morning before rising and every night before sleep. You may notice a slight warmth spreading downward into your thigh. That is exactly the response you are looking for. Robert, 76, a retired school teacher, came to my clinic after his wife encouraged him to seek help. He had accepted his situation as permanent. He genuinely believed that at 76, there was nothing left to do. He had been told by 2 previous doctors to manage expectations. I introduced him to the inguinal press technique alongside 2 others from today's list. After 6 weeks, Robert sent me a handwritten note, an actual letter in the mail. In it he wrote, "Doctor in the mail." In it he wrote, "Dr. Collins, I owe you more than I can express. My wife and I have reconnected in ways I thought were gone forever. I feel like a man again." He was 76 years old. I want you to hear that. 76. But I promise you, number 3 is where things get really interesting. This next technique involves a spot on your lower back that almost no one talks about. Stay with me. Here is something your anatomy textbook probably never highlighted. The base of your spine is one of the most direct access points to the nerve network that controls blood flow down there. The sacrum, the triangular bone at the very base of your spine, houses the sacral plexus, a dense bundle of nerves that govern circulation, sensation, and function in your entire pelvic floor region. Most men know nothing about this, and that is a significant missed opportunity, especially after 60. Let me explain why this works on a biological level, because understanding the mechanism helps you stay committed. The sacral nerve roots S2, S3, and S4, which emerge from small openings in the sacrum, called foramina, are directly responsible for the parasympathetic nerve signals that trigger pelvic blood flow. These are the same nerve pathways that a device called a sacral neuromodulator stimulates electrically in clinical settings. You don't need a device. Firm manual pressure applied to the sacral surface can achieve a milder but real version of the same stimulation. When you apply rhythmic pressure to the sacral base, you also release tension in the piriformis and iliococcygeus muscles, deep pelvic floor muscles that, when tight, literally compress the pudendal artery. Releasing that compression is like unclamping a garden hose. Flow increases immediately. This is why many men notice that after lower back pain resolves, other things improve as well. The connection is not coincidental. It is anatomical. Research published in Neurology and Urodynamics in 2020 demonstrated that sacral surface stimulation in men over 65 years induced statistically significant improvements in pelvic nerve conduction velocity after 8 weeks of consistent application. Pelvic nerve conduction is the speed and strength of nerve signals reaching the area, and stronger signals mean faster, more reliable blood flow response. Here is the exact protocol I give my patients. Sit in a firm chair and reach behind you to locate the flat triangular base of your spine, just above your tailbone. Using both thumbs or a firm rubber ball placed against the chair back, apply steady pressure to this area for 60 seconds. Breathe deeply and evenly. You can also do this lying face down with a tennis ball placed beneath the sacral area. Apply gentle rocking pressure for 60 seconds each morning. Many of my patients combine this with their morning stretch routine. It takes 60 seconds. The return on investment is remarkable. Thomas, 68, came to me after a lumbar surgery that had left him with nerve sensitivity in his lower back. He assumed any chance of restoring his performance was gone. His surgeon had told him to be realistic. After 8 weeks of the sacral press technique, Thomas reported something he described as a gradual awakening. Not overnight, but steady, consistent, measurable improvement. By month 3, he told me his morning wood had returned for the first time in almost 3 years. He said, "I thought that part of my life was over. I had made peace with it. I hadn't realized I was surrendering too early. Thomas did not need to surrender, and neither do you. But hold on, because number 2 is where the real power begins. This next technique targets a spot that directly feeds the primary artery responsible for everything happening down there. Do not click away. What I am about to show you is something that vascular surgeons have known for decades, but that almost never makes it into a men's health conversation. There is a pulsing point in your lower abdomen that sits directly above the aortic bifurcation, the exact location where your body's largest artery splits into the 2 vessels that feed your pelvic region. This is not mystical. This is not alternative medicine. This is anatomy. The abdominal aorta runs down the center of your abdomen and, at roughly the level of your navel, splits into the left and right iliac arteries, the primary blood supply to everything below the waist. Stimulating this bifurcation point manually is one of the most direct ways to influence pelvic blood flow available to you without a prescription. Let me explain why this works on a biological level, because understanding the mechanism helps you stay committed. In many men over 60, the aortic bifurcation point becomes surrounded by mild fascial adhesion, connective tissue tightening that develops gradually from prolonged sitting, reduced movement, and age-related tissue changes. This adhesion does not block the artery, but it does create surrounding pressure that subtly restricts flow and dampens the pulsatile strength of blood moving into the pelvis. Manual pressure at this point, applied gently but specifically, helps release surrounding fascial tension, increase local warmth, and promote what physiologists call reactive hyperemia, a surge of increased blood flow in response to momentary compression, followed by release. It is the same principle used by physical therapists when working with restricted tissue: compress, hold, release. The rebound effect opens the pathway significantly. Additionally, this stimulation activates mechanoreceptors in the abdominal wall that send signals via the vagus nerve to the heart, mildly increasing cardiac output to the lower body. More cardiac output, more pelvic perfusion, more of everything you want. A 2019 study in vascular medicine examined manual abdominal vascular stimulation techniques in men aged 55 to 75 with mild to moderate pelvic circulatory compromise. Over an 8-week protocol, participants showed a 24% increase in measured femoral artery flow velocity and reported significant subjective improvements in vitality and performance. The lead researcher noted that the technique was surprisingly underutilized given its accessibility and safety profile. 24% increase in blood flow from a 60-second technique, no prescription required. Here is the exact protocol I give my patients, and I want you to follow this carefully. Lie flat on your back with your knees bent and feet flat on the floor. Place the flat of your hand, all 4 fingers together just below your navel, in the center of your lower abdomen. Press gently inward and slightly downward until you can feel a faint pulsing sensation beneath your fingers. That is your aortic pulse. Hold steady, gentle pressure for 30 seconds, breathing slowly and deeply, then release completely and rest for 10 seconds. Repeat twice. This entire sequence takes under 90 seconds. Do it every morning before you get out of bed. Important note: if you have known abdominal aortic aneurysm or have been told to avoid abdominal pressure by your physician, skip this technique and speak to your doctor first. William, 64, a retired contractor from Texas, came to me after his general practitioner told him his blood work was fine and there was nothing physically wrong. He was frustrated, confused, and frankly, embarrassed to even be in my office. He told me he felt like his masculinity was slipping away and he didn't know how to talk to his wife about it. After 6 weeks of the lower abdomen protocol combined with 2 other techniques from today's list, William reported that his morning firmness had returned to levels he had not experienced in 5Y years. He told me, "Doc, I walked in here feeling like half a man. I'm walking out feeling whole again." His wife called my office separately to thank me. That is the kind of moment that reminds me why I do this work. James, 79, surprised even me. He came in with his daughter, who had practically dragged him to the appointment. He was convinced nothing could help at 79. We started him on the aortic press, combined with the sacral technique. By week 4, he called my nurse and said, and I quote, "Tell Dr. Collins she owes me an apology for not teaching me this 20 years ago." He was laughing when he said it, but he meant it. And now, the moment you have been waiting for. Number 1. The most powerful technique on this entire list. The one that ties everything together, and the one that can begin showing results within days, even if you are in your late 70s or 80s. Gentlemen, this is the one, and I want you to listen very carefully because what I am about to share with you is the single most direct, clinically validated, non-pharmacological technique available for restoring blood flow down there, and it is almost never discussed outside of specialist urology circles. The perineum, the area of soft tissue located between the base of your body and the tailbone, contains the pudendal nerve and the internal pudendal artery. These are the primary nerve and blood supply to your entire intimate region. Most men have never heard of this area. Fewer still have any idea that it holds the physiological key to restoring what time and lifestyle have quietly taken away. This is not a new discovery. Pelvic floor physical therapists have used perineal techniques for decades. Urologists use them in post-surgical rehabilitation. And the research supporting this technique in men over 60 is among the strongest in non-pharmacological men's health. Let me explain why. This works on a biological level because understanding the mechanism helps you stay committed. The pudendal artery is the dominant blood supplier to the intimate region in men. In men over 60, this artery is frequently subject to what clinicians call pudendal arterial insufficiency, a reduction in flow caused by a combination of arterial narrowing, surrounding tissue tension, and reduced nitric oxide signaling. It is the single most common vascular cause of performance decline in older men, and it is rarely addressed directly. The perineal pressure technique works through 3 simultaneous biological pathways. First, manual pressure at the perineal body directly stimulates the bulbous pondeosus and ischiocavernosus muscles, the muscles responsible for creating and maintaining firmness. Contracting and releasing these muscles through external pressure exercises them, the same way squeezing a rubber ball exercises your hand grip. Second, sustained pressure on the perineal body stimulates mechanoreceptors that send vasodilatory signals directly through the pudendal nerve to the surrounding vascular tissue. This triggers local nitric oxide release, immediate, localized, and powerful. Third, this technique releases chronic tension in the pelvic floor, tension that most men over 60 carry without realizing it, and that chronic tension is one of the biggest invisible barriers to blood flow in this region. Releasing it is like finally unclenching a fist you did not know you were making. A landmark 2023 study published in the Journal of Urology followed 187 men aged 62 to 81 who implemented a daily perineal pressure and pelvic floor activation protocol for 12 weeks. The results were striking. 74% of participants reported meaningful improvement in firmness and morning function. 61% reported results within the first 3 weeks, and the average improvement in blood flow velocity in the internal pudendal artery measured by Doppler ultrasound was 31%. 31% increase in direct arterial flow in men up to 81 years old from a 60-second daily technique. This is not anecdotal. This is measured, published, peer-reviewed data. A separate 2021 review in Aging Male concluded that perineal stimulation combined with pelvic floor activation was as effective as low-dose pharmacological intervention in men with mild to moderate vascular performance decline with 0 side effects. Here's the exact protocol I give my patients, and I want you to start this tonight. Sit in a firm chair or lie on your back with knees bent. Locate the perineal body, the midpoint between where you sit and the base of your body. You will feel a slight ridge or firmness at this midpoint. Using 2 or 3 fingers held together, apply gentle but deliberate upward pressure to this point. Hold for 10 seconds. Release for 5 seconds. Repeat this cycle 6 times. Total time, approximately 90 seconds. Simultaneously, and this is what makes this technique so powerful, contract your pelvic floor muscles as if you are stopping the flow of urination. Hold the contraction for 5 seconds. Release for 5 seconds. Do this in rhythm with your finger pressure. Perform this technique once every morning before rising and once every evening before sleep. Within 3 to 7 days, most of my patients begin noticing changes in morning firmness. Within 3 to 4 weeks, the results become consistent. Edward, 73, a retired naval officer, came to me after his wife of 44 years had gently but honestly told him she missed their intimate life together. He was devastated. He had spent 2 years avoiding the conversation, assuming it was permanent. He sat in my chair and told me he had never felt so old in his entire life. I started Edward on the perineal technique immediately. I taught it to him in the office. 7 days later, he called my nurse, barely able to contain himself. Something happened this morning, he said. Something I had completely given up on. By week 4, Edward described his results as better than I expected. Far better. He told me, "Dr. Collins, you gave me back something I thought was gone. Not just physically. You gave me back my confidence. My marriage feels different. I feel like myself again." Edward is 73, and he feels like himself again. That is everything. And then there was Frank, 81 years old. A widower who had started a new relationship at 79 and was quietly terrified that his body would let him down. His new partner was 74 and, as he put it, remarkably patient, but I didn't want to test that patience forever. Frank implemented the full protocol from this video. All 5 techniques. Every morning, every evening. At week 6, he sat in my office with the straightest posture I had ever seen him hold and said, "I have no complaints, none, and neither does she. 81 years old. No complaints. That is what is possible. That is what your body is still capable of when you give it the right signals." All right, gentlemen. Here is your complete implementation system, and I want you to start tonight. Tonight, begin with technique number 1, the perineal pressure protocol. Do it before you go to sleep. 90 seconds. That is your only commitment tonight. Tomorrow morning, add technique number 2, the lower abdomen aortic press. Do it lying in bed before you rise. Combine it with your perineal protocol. This week, add technique number 3, the sacral base press, to your morning routine. Track your baseline right now. Note how you feel in the morning. Write it down. Specific observations. Weeks 2 through 4. Add techniques 4 and 5, the inner thigh lymph press and the wrist pulse point. You now have the complete 5-technique daily sequence, morning to evening. It takes under 8 minutes total. What to expect? Most men notice a first meaningful change between days 3 and 10. Consistent improvement builds through weeks 3 to 6. By week 8, the majority of my patients describe results they describe as transformational. Track your morning firmness daily. Rate it 1 to 10. Watch that number climb. Gentlemen, let's bring this home. Today I gave you 5 specific research-backed 60-second techniques that directly restore blood flow to the area that matters most for your vitality, your confidence, and your intimate life. Number 5. The wrist pulse point press awakens your vascular system through your nervous system. Number 4. The inner thigh lymph press removes the drainage blockage restricting pelvic flow. Number 3. The sacral base press directly stimulates the nerve roots governing everything down there. Number 2. The lower abdomen aortic press opens the primary arterial highway to your pelvic region. Number 1. The perineal pressure technique, the most direct, most powerful, and most immediate technique available to any man at any age. Here is what I need you to remember. Over 52% of men over 60 experience significant decline in blood flow down there. But that statistic is not a sentence. It is a starting point, because men who address circulation directly, consistently, daily experience results that most of their peers have written off as impossible. Edward is 73 and feels like himself again. Frank is 81 and has no complaints. You are not too old. You have not missed your window. Your body is waiting for the right signals, and now you know exactly how to send them. You have more power over this than any prescription bottle has ever given you. These techniques cost nothing. They require no doctor's visit, no pharmacy, no side effects. Just 60 seconds, the right spot, and the commitment to show up for yourself every single day. Start tonight. Not tomorrow. Not next week. Tonight. I'm Dr. Sarah Collins, and I want you to hear this directly from me. Restoring your vitality after 60 is not a fantasy. It is physiology. And physiology responds to the right input at any age. Now, hit that like button if this video gave you something invaluable. Leave a comment below and tell me which technique surprised you the most. I read every single comment and I respond as often as I can. Subscribe to this channel because next week I am releasing a video on the 3 foods that block blood flow down there in men over 60. And number 2 on that list is something almost every man eats every single day. You don't want to miss that one. I'll see you there. Take care of yourselves, gentlemen. You deserve it.